All right, welcome back, everybody. This is Home Heart Health, and I am the Nurse Ninja. And today we are going to be going over test taking strategies. Let me go ahead and share my screen with you. This will be part of probably a 2 or 3 part series that I'm going to do. I'll try and keep them to about 30 minutes each to make them a little bit easier to digest. But I really want to dig into test taking. This is an area of anxiety for a lot of people. If we can demystify test taking through these different approaches, we can help you know what to do when you don't know what to do. If you know the answer to a question, awesome, choose that answer. If you're stumped, if you're unsure, if you're in doubt, these are strategies that can help you navigate those questions and come to the right answer. And these aren't tricks like always pick C. That's silly. These are ways of thinking that augment our critical thinking that we want to build as nurses. So with that, let me share my screen with you, and we will go into the first part of our test-taking strategies series here. All right. The first step in demystifying testing is understand what the question is asking. We're going to look at the stem of several questions throughout this series. And we want to look for keywords in the stem of the question that let me know what it really wants to know about. Is the question asking for a true statement or a false statement? Is it a prioritization question? What are the keywords in the stem or root of the sentence that's going to tell me what it really wants to know? We want to eliminate any obviously wrong answers. And then we're going to use true false approaches, especially with our select all that apply questions, because those are really intimidating for people to rule out incorrect answers. And we're also going to rule out options that are alike. If there's two things and they're basically kind of the same thing, well, then clearly that can't be the right answer because which one of them would you pick? All right, so those are some basic strategies that you may have heard about. And then coming back to that true or false approach to select all that apply questions, select all that apply are very intimidating, right? You can really start to doubt yourself on those. And that would be, we'll have some examples later on in the recording, but that would be, I have a scenario in my question and I am to select the risk factors for a DVT. And that's what I need to answer. And I then have a list of like 8 different things, and I need to identify which ones are risk factors for DVTs. And if I select things that aren't risk factors for DVTs, I lose points. So people get real scared by these. But really, truly, a select all that apply question is simply a bunch of true and false questions. And statistically, true and false questions are very easy to answer for people. So when we get to select all that apply questions, I'll show you how we apply that. But if you can turn it into 8 true or false questions instead of 1 select all that apply questions, it takes a lot of the stress off your plate. All right, things we want to avoid. We want to avoid what if syndrome. We want to focus only on the data in the question. If I'm reading a description of a patient in my question and it gives me a bunch of vital signs about like an increased respiratory rate and uh, a cough, but it doesn't give me their temperature, I don't want to invent the idea that they have a fever. They might have a cough and an increased respiratory rate for not because they have an infection. Maybe they have congestive heart failure. Maybe they have cancer. Maybe there's a bunch of different things that could cause an increased respiratory rate and a cough that don't have anything to do with a fever. So I don't want to add things to the question that were not there to begin with. I want to focus on only what the question is asking. Don't read into the question. Again, don't invent a fever when none was listed. And don't read your own personal experiences into the question. If you're already in a nursing program, you've probably done some clinicals. It's very easy to start thinking about that really intense patient that you saw at clinicals last week who is sort of like this and also had this other weird thing happen. Well, that weird thing must be part of this question because this patient reminds me of that. And now we end up chasing squirrels and we get confused and we miss a question that we would have otherwise gotten if we hadn't played the what if game. So don't read your personal experiences into the question. If you haven't had clinicals yet, we all have personal health experiences. Our personal health experiences, Uncle Bob's personal health experience from our family. Don't read your personal experiences into the question. Okay, this is going to be our first practice question. Do not look at the answers. Do not try to read it yet. I know we want to. We want to jump in there and get the answer right? Because that's our society. We advance forward in our knowledge by getting the answer right. We get a raise at work because we did the right thing. Our mom pats us on the head because we did the right thing. We want to come to the correct answer as fast as we can because we're trained for that, but that can get in our way. So right now, you and I, there's no test, there's no one else in the room. No one's going to know if you got the question right or wrong. This is a very low stress environment to address these questions on purpose because I don't care if you figure the question out right away. I'm not going to know. You're listening to this as a recording. What I want you to do is I want you to take this low stress environment to start building test taking muscle memory, mental muscle memory. And the first thing I want you to learn how to do is read a question without looking at the answers. Okay, so we're going to read this question, and the first thing I want to know is it looking for a true statement or a false statement, okay? So we're going to read the question 3 times together out loud, and we're just going to look for, is it a true statement or a false statement that we're looking for, and we're going to absorb the question, okay? Trust me with this. So what I want you to do for this first one, I'm going to read it out loud to you 3 times. I want you to read it out loud with me. I'm not going to do this for every single one of these questions for the sake of time, but what I want you to do when you are practicing and going through these test-taking strategies, every time I get to a new question, I want you to pause the video and I want you to read it 3 times to yourself out loud, if possible. It will totally change your understanding of what the question is asking if you do this. And I want this to become your muscle memory. When you brush your teeth, you don't have to think about moving the toothbrush back and forth. Your muscles just do it. That's what I want reading the question 3 times to become for you. Okay, so let's do this together. A nurse is preparing to administer an intravenous medication to a patient. Upon checking the IV site, the nurse observes swelling, redness, and warmth at the site, along with the patient complaining of pain. Which of the following actions should the nurse take? A nurse is preparing to administer an intravenous IV medication to a patient. Upon checking the IV site, the nurse observes swelling, redness, and warmth at the site, along with the patient complaining of pain. Which of the following actions should the nurse take? A nurse is preparing to administer an intravenous medication to a patient. Upon checking the IV site, the nurse observes swelling, redness, and warmth at the site, along with the patient complaining of pain. Which of the following actions should the nurse take? All right. I know it's a true statement that they want because it says which action should the nurse take. So they want something true. There's no prioritization indicators in this, so I know it's a true statement, and I know that the only one of these answers will be correct. Okay. So now I'm going to start to look at my answers, and I'm going to look at them one at a time. And if it is a true statement about the question, I'm going to leave it on my consideration list. If it's not a true statement, I'm going to remove it from my consideration. That is no longer the correct answer. If half of the answer is true, but the other half of the answer is not correct, the whole thing is not correct. It can't be partway true. Okay, so 1, discontinue the IV and apply a warm compress to the site. What do you think? Is that appropriate to do in this situation or inappropriate to do? If it's appropriate, that's your answer. If you're not sure, but it sounds kind of appropriate, just leave it on your consideration list. Increase the IV infusion rate to flush the medication through. Is that an appropriate thing to do, or would that be an inappropriate thing to do? 3, document the findings and continue the infusion at the same rate. Again, is that appropriate or inappropriate? 4, change the IV dressing and continue the infusion. Again, is that appropriate or inappropriate? And if we move on to our next slide here, we get the answer. So in this case, option 1 is our correct answer because of the signs of swelling and redness, warmth, and pain at the IV site, which suggests phlebitis or infiltration of the IV. The nurse should discontinue the IV to prevent further complications and apply a warm compress to help reduce inflammation and discomfort. I'm going to go through our wrong answers here as well. Option 2 is incorrect because increasing the infusion rate could worsen the condition and cause more irritation or infiltration to the vein, exacerbating your problem. Option 3 is incorrect because continuing the infusion at the same rate without addressing the inflammation could lead to further complications. The nurse should stop the infusion and assess the site further. Option 4 is incorrect because simply changing the dressing without addressing the underlying issue will not solve the problem. The IV should be discontinued first, and that's an example of it can't be part wrong and part right. We would definitely discontinue this IV, we would definitely discontinue and change the dressing, but we could not continue the IV infusion. So that one is definitely wrong. All right, so there's an example of a true STEM question. Oh, I forgot I put cute little animations in here for you. All right. Now we're going to look at an example of a true STEM question. So it'll be, again, a true answer that we're looking for. But now we're going to look at it as a select all that apply question using a true false approach to determine the answer. All right, we're going to read that through 3 times to ourselves. The nurse cares for a client diagnosed with a right-sided cerebrovascular accident, or CVA, with dysphagia. Which of the following actions by the nurse reflects appropriate care for the client? The nurse cares for a client diagnosed with a right-sided cerebrovascular accident, or CVA, with dysphagia. Which of the following actions by the nurse reflects appropriate care for the client? The nurse cares for a client diagnosed with a right-sided cerebrovascular accident, or CVA, with dysphagia. Which of the following actions by the nurse reflects appropriate care for the client? Okay, we've read it 3 times through. It's a select all that apply question. We're going to read through each of these answers and see if it is true or false about the question. So we have a right-sided stroke, CVA, with dysphagia. 1, the nurse assesses the client's ability to swallow. Is that appropriate or inappropriate for a patient who has had a right-sided stroke? 2, the nurse positions the client at a 45-degree angle. Is that appropriate or inappropriate to do for this patient? Again, Don't read into the question. What does it actually say? What is a 45-degree angle? Right now, I am sitting at a 90-degree angle. If I were to chew steak and swallow, even having no dysphagia, I would be able to swallow this way. With dysphagia, I would be able to swallow safest this way. This is a 90-degree angle. Half of 90 is 45. That's a 45-degree angle. I don't want to swallow steak like this. So that is lowered head of bed. This is sitting fully upright. That's the proper position to swallow. So 2, would that be appropriate or inappropriate for this patient? So again, look at the data, the question, and the answer actually says. The nurse offers the client scrambled eggs. Is that appropriate or inappropriate to do for a patient that's had a right-sided CVA and has dysphagia? 4, the nurse instructs the client to place food on the left side of the mouth. Is that appropriate or inappropriate for a dysphagic patient? Or 5, the nurse turns off the television. Would that be appropriate or inappropriate to do with a dysphagic patient? Let's see what our answers say. All right, in this case, our strategy, excuse me, there we go. One more box to click there. Our strategy hopefully worked for us. If not, you've now got an example of how this works, so you can get better at these, because we can get better at these kinds of questions. It's a skill. Number 1, number 3, and number 5 were our appropriate answers. The nurse assesses the client's ability to swallow. Certainly, anytime a patient who has a history of dysphagia and a stroke, we need to make sure they can swallow safely before we give them any food. The nurse positions the client at a 45-degree angle. I just kind of went over what's wrong with that one. You want them sitting upright, not halfway upright. 3 is correct. The nurse offers the client scrambled eggs. NCLEX loves dietary questions. Scrambled eggs are part of a dysphagic diet. They're mechanically soft, right? They're soft enough that it's easy to swallow, but not so wet that it can slide down the wrong pipe and end up in their lungs. So scrambled eggs are an appropriate dietary choice. Now you might say, but my patient hasn't been cleared to eat yet. Does it say anywhere in the stem of that question that your patient is NPO or nothing by mouth? No, it does not. Does it say how long ago that stroke was? Oh, no, it doesn't. If that stroke happened 10 years ago, I certainly think they've let my patient eat since then. So don't invent an NPO order in this case where none exists. We are simply given a CVA patient with dysphagia. Scrambled eggs would be appropriate for a CVA patient with dysphagia to eat. 4, the nurse instructs the client to place food on the left side of the mouth. That's incorrect. The problem here is with managing their airway and swallowing safely. It does not matter which side they chew the food on, it all goes down the same pipe, right? They're expecting that would be a hard one because right-sided strokes tend to affect the left side of the body. So they're kind of playing off on that unilateral presentation that a lot of us are aware of. The nurse turns off the television. This one stumps a lot of people. For moms out there with kids, or for young adults who are studying, or teenagers who are studying, I know you think you learn better with the TV on, you don't. If you are giving someone directions and the television's on, will they remember your directions really well? Or would they remember your directions better if you turned the TV off and had their full attention? That's exactly right. When we are feeding a patient with dysphagia where they're eating, we want to minimize distractions so they can focus fully on swallowing safely. So the nurse turning off the television would be appropriate in this select all that apply question. There you go. There's your 3 correct answers. All right, false stem questions. A false STEM question presents an incorrect or misleading statement in the question, and the student must recognize the error and select the correct response instead. And here's our example. So what's the first thing we're going to do? We're going to read this question 3 times out loud to ourselves. I'm not going to do it this time. You're going to do it. You're going to pause the video and read it 3 times to yourself. I'll read it the first time with you. A nurse is preparing to discharge a patient after undergoing surgery for a hip replacement. The nurse recognizes a need for further education when the patient does which of the following? And you should have paused the video, read that 2 more times to yourself, and now hopefully you're back on with me. And we've read it 3 times. And the reason I know that this question wants me to choose a false statement is because of the words further education. Would require further education. Needs to be addressed. Should not be done. Would be an error. Those are different things I might see in the stem of a question that would tell me, oh, we're looking for a false statement here. Now that seems really obvious and easy, but this is a really hard style of question for people because again, we have decades of experience of picking the right thing, doing the right thing, making the right choice. We've been trained and drilled to do this. With this, we're being asked to go against our muscle memory and pick the wrong thing. But they need you to be able to show critical thinking and being able to identify something you need to correct. Again, you can see how that would train us to rescue a patient. If someone's about to do something that could hurt our patient, we want the alarm bells to go off in the nurse, and we want that nurse to have the courage to go, whoa, 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 whoa. And I see you're about to give that medication. Can you please teach me why we're doing that to this patient? Because I think that would cause harm. That's what we want in a nurse. So a false STEM question is a good way, not just to get critical thinking going here, but to train those nurses to challenge when they see an unsafe thing being done in the hospital. Okay, so we've read through our question 3 times. We know they want a false answer. So one answer will be the answer we want, and we're looking for the false statement. A, states that they will continue taking the prescribed blood thinner as directed for the next 6 weeks. B, asks about potential side effects of blood thinners and how to manage them. C, reports stopping the blood thinner because they feel it is no longer necessary. Or D, verbalizes understanding of the importance of follow-up appointments to monitor blood clotting levels. We're looking for the false statement. Did you find it? And we are looking at number 3. We want the patient, we're going to check 3 because reports stopping the blood thinner because they feel it's no longer necessary would need further education. We do not want our patients to stop a medication without going through their provider because some drugs can be dangerous to stop or to stop suddenly. So because they don't think they need it anymore is not a good reason to stop taking a blood thinner or an anticoagulant, right? We want them to report that to the provider, and if they need to come off of it, to do it with their provider. So that would require further education. That's the wrong thing to do. The rest of those are very appropriate. Option 3 is correct because discontinuing the prescribed medication such as a blood thinner without medical guidance can increase the risk of complications like deep vein thrombosis, DVTs, or pulmonary embolism, PEs. Patients should be instructed to continue taking medication as prescribed and to discuss any concerns with their healthcare provider before stopping any medication. Option 1 is correct because the patient continuing the blood thinner as prescribed is appropriate. It's essential to follow the the prescribed duration to prevent blood clot formation after surgery. Option 2 is correct because asking about side effects and Option 2 is correct because asking about side effects and management is a sign that the patient is engaged in their care and seeking to understand the medication regimen. Option 4 is correct because verbalizing understanding about the importance of follow-up appointments and monitoring blood clotting levels shows that the patient understands the need for ongoing care after surgery. There we go. There's a false STEM question. Okay, we're going to very briefly talk about prioritization questions and strategies for prioritization questions. Then we're going to pick back up, kind of rehashing the end of this recording in the beginning of the next, in case you start with that one, to practice these prioritization strategies with some additional questions. So priority questions compose the majority of the NCLEX style questions that you're going to run into. Common words that indicate the need for prioritization. So the stem of the question will say, is the best, is essential, should be done first, is the highest priority, must be done immediately. Those are the kinds of words we're looking for that will tell us it's a prioritization question. And remember, when you have a prioritization questions, you're going to see more than one answer that is the right answer to pick. Or excuse me, let me rephrase that. More than one answer that is correct. What we want you to do is we want you to be able to identify the most correct of the correct answers. All the options might be correct. You need to determine the correct order of action and choose the one we're going to do first, or that is the highest priority. All right, your strategies for prioritization questions. These are your primary strategies. There's a subset of strategies that I'm going to do in your third video, and we'll get some practice with those. But these are your 7 common large categories for strategies, approaches, battle plans on how to figure these questions out. ABCs, that stands for airway, breathing, circulation. Outside of doing CPR, we always follow airway, breathing, circulation as a strategy for prioritization, where airway is the most important. It's the highest priority. If someone has an open airway, but they have pneumonia, pneumonia is a breathing problem. We're not doing really good gas exchange in our lungs because they're full of junky crud, right? That's a breathing problem. An airway problem would be someone's having an allergic reaction to peanuts and their airway is closing and they cannot get any air into their lungs. You will die very, very quickly if you lose your airway. Breathing won't kill you as fast as losing your airway, but breathing is also a major priority and will kill you quicker than usually a circulation problem. So airway problems take highest priority, then a breathing problem would take a high priority, and then a circulation problem would be our next priority in patient care. So airway is literally your trachea, the opening that air flows into your lungs and carbon dioxide flows out of your lungs, right? So airway problems. Stridor, the sound stridor is the sound of someone losing their airway, right? Anaphylaxis, swelling lips and a swelling tongue. That swelling can close off my airway. Those are examples of airway problems. A breathing problem. Someone has ground glass opacities in an x-ray and has pneumonia. That's a breathing problem. A high respiratory rate or a low respiratory rate would be a breathing problem. A low pulse oximetry reading could be a breathing problem. So they might ask it to you in different ways to make sure you understand what constitutes an airway problem, a breathing problem, or a circulation problem. So respiratory rate is big for breathing. Strider and pulse oximetry, big for airway and breathing, more depth. It's not necessarily diagnostic for one or the other, but it'll be a vital sign that changes with both. And then circulation. This throws people. So circulatory problems, we're talking about blood flow in the body, right? So we're looking for evidence of a circulatory problem. If you get dehydrated, you're going to have less volume in your blood, and you're going to have low blood pressure, a fast heart rate, and poor delivery of oxygen to your vital organs in your body. That's a circulatory problem. Dehydration is a circulatory problem. Evidence of dehydration or evidence of a circulatory problem might be low blood pressure, high heart rate. High heart rate's not just circulation, but low blood pressure is a circulatory problem. So look at their blood pressure to see if it's a circulation problem. Is it a fluid in problem? Is it a loss of blood problem? Is it a vomiting diarrhea where I'm losing fluid? Those are circulatory concerns because they're going to affect my blood pressure because of my patient's hydration status. Another key indicator that we're talking about a circulatory problem is urine output. If my patient's urine output suddenly drops, I have a circulation problem with that patient. They are either bleeding and don't have enough blood flow to make urine, or they're dehydrated, same problem, or maybe they have kidney problems that are causing a backup of fluid, and now I've got too much fluid in circulation. All of those affect the circulatory system. So those are C, circulation problems. Okay, Maslow's hierarchy of needs. Maslow's hierarchy of needs says that physical problems have higher priority than emotional, psychosocial, educational problems. Steps in the nursing process. We always assess before we intervene. So if I have a prioritization question and I have 3 answers that are all very appropriate nursing actions. Start CPR, call for help, hook up the defibrillator pads onto the patient, and one of them is assess respiratory rate, even though the adrenaline in my body makes me want to do something else. With the steps of the nursing process, the correct answer would actually be, the priority would be to assess first. So that's a strategy for finding, well, all of those seem appropriate, but one of them is an assessment. The rest of them are actions. Then using the steps of the nursing process, I would have to prioritize the assessment before the action. Acute versus chronic. Acute problems always take priority over chronic problems. Stable versus unstable. And again, a big indicator of stability is blood pressure. If your patient's hypotensive, that's unstable. You can be tachycardic with a normal blood pressure and you're just tachycardic, you're stable. If you're tachycardic and your blood pressure is low, that's a sign of instability. Sudden cognitive changes are signs of instability in your patient. So start to look and see what constitutes unstable. The least restrictive or least invasive. If you've got a confused patient and your options are, they're confused, they're a fall risk, my options are order Haldol to chemically restrain my patient, apply soft restraints to protect my patient from a fall, or get a sitter for the patient. Getting a sitter is my least restrictive and least invasive mechanism there. So that would be the priority intervention there, the least invasive or the least restrictive. And then survival potential. And that one has to do with triaging. If there's a mass casualty event and you have limited resources and you have 5 patients that come in the door and you can only save one of them, we're going to look and see which one could be saved. If you have a patient who's been in a mass trauma and they have brain matter leaking out of their head and they're only agonally breathing, we probably can't save that patient. You have another patient that's lost an incredible amount of blood and is very pale and diaphoretic and screaming in pain. Oh, they're screaming. They're conscious. they can breathe. They've lost a lot of blood. They need help, but I might be able to save that one. So that's an example of survival potential, and it's very specific to like triaging questions. All right, I'm going to go ahead and stop there for now. We'll pick this back up in our next recording on test taking strategies. And I'll start off with just a quick over those last 2 slides for the beginning of the next one, just to kind of recap us in case it's a little while before you go into the next one. All right, I hope this has been helpful in demystifying some of our intimidating NCLEX style questions. And I will see you soon. And in the meantime, happy studying.